Hello everyone, welcome back to our channel. We are Healthy Care. As we age, our bodies go through a variety of changes that can catch us off guard and leave us feeling frustrated. One of the most troubling changes is the gradual loss of balance. Suddenly, tasks that once felt simple, like walking or standing still, can feel unsteady or even lead to falls. This isn't just an inconvenience, it's a real danger that can lead to serious injuries. But what exactly is happening in our bodies that causes this decline in balance? More importantly, how can we address it and stay safe as we get older? In today's Healthy Care video, we'll be uncovering the top reasons why balance begins to falter after 60. As we grow older, our balance weakens due to a mix of physical and neurological changes. The vestibular system in the inner ear, which is essential for keeping us upright, becomes less responsive. Vision also starts to decline with conditions like cataracts, while muscles and joints lose their strength and flexibility. A slowing nervous system adds to the challenge, making it harder for the body to react quickly. All of these changes increase the risk of falls, but with the right balance and strength exercises, many of these effects can be slowed or even reversed. Make sure you stick around until the end. Reason number 7 is one of the most dangerous and often overlooked causes. Now let's take a closer look at the 13 main factors that contribute to balance issues in older adults. 1. Cognitive decline. Cognitive decline, which includes memory loss, slowed reaction times, and impaired decision-making, can have a significant impact on balance as we grow older. The brain is responsible for processing sensory information from the eyes, ears, and body to coordinate movement and maintain balance. When cognitive function is impaired, the brain struggles to process this information quickly and accurately, making it harder to maintain balance, especially in complex environments like crowded streets or uneven terrain. Conditions such as Alzheimer's disease, dementia, or even mild cognitive impairment can affect an individual's ability to multitask, further compromising balance. Cognitive decline may also reduce awareness of surroundings, increasing the likelihood of accidents. Engaging in mentally stimulating activities, such as puzzles, reading, or learning new skills, can help slow cognitive decline and improve coordination. Physical activity, especially exercises that combine movement and mental engagement such as dancing, can also enhance cognitive function and balance. 2. Postural changes. As the years pass, age-related changes in posture, such as a more stooped stance, forward head position, or rounded shoulders, can significantly affect balance by shifting the body's center of gravity. Poor posture often develops gradually due to muscle imbalances, joint stiffness, and weakened core muscles. Conditions like osteoporosis can lead to spinal curvature kyphosis, further altering posture and making it difficult to stand or walk with proper alignment. A shifted center of gravity increases the likelihood of falling, especially during activities that require quick movements or changes in direction. Exercises that strengthen your core, back, and neck can help improve your posture and balance. Stretching exercises and yoga can also help improve flexibility and posture, reducing the risk of falls. 3. Decreased foot sensitivity. With advancing years, the soles of our feet, equipped with thousands of nerve endings, can lose their sensitivity, affecting our ability to detect surface textures, pressure, and balance. Conditions such as diabetes, peripheral neuropathy, and peripheral artery disease can exacerbate this issue, making it harder to detect changes in terrain and maintain balance. Reduced foot sensitivity impairs the body's ability to make the small, rapid adjustments needed to stay upright, particularly on uneven or slippery surfaces. For individuals with diabetes, regularly checking the feet for signs of nerve damage and maintaining good foot hygiene is essential to prevent complications. Wearing proper footwear that offers support and stability can also help improve balance. Exercises that stimulate the feet, such as walking barefoot on different surfaces or using a balance board, can improve proprioception and foot sensitivity, ultimately enhancing balance. 4. Fear of falling. Fear of falling is a common psychological factor that can paradoxically increase the risk of falls. Individuals who have experienced a fall or know someone who has fallen may develop a heightened fear of falling, which leads to excessive caution. This fear can result in tense, rigid movements, making it harder to maintain natural balance. The fear of falling often leads to a decrease in physical activity, as individuals may avoid walking, climbing stairs, or engaging in activities that they perceive as risky. Unfortunately, reduced physical activity leads to muscle atrophy and joint stiffness, which further exacerbates balance problems and perpetuates the fear of falling. This vicious cycle can lead to social isolation, depression, and anxiety, all of which contribute to poor balance and mobility. Working with a physical therapist or participating in a fall prevention program can help individuals build confidence, improve strength and balance, and break the cycle of fear. 5. Dehydration. As we get older, dehydration becomes more of a concern due to a diminished sense of thirst and the use of medications like diuretics that increase fluid loss. Dehydration can have a profound impact on balance and cognitive function. When the body is dehydrated, blood volume decreases, leading to a drop in blood pressure, especially when standing up quickly. Orthostatic hypotension. This sudden drop in blood pressure can cause dizziness, lightheadedness, and an increased risk of fainting or falling. Additionally, dehydration can lead to muscle cramps, weakness, and fatigue, all of which impair balance and coordination. In extreme cases, dehydration can cause confusion, delirium, and cognitive impairment, making it difficult to focus on maintaining balance. To prevent dehydration, individuals should drink water regularly throughout the day, even if they do not feel thirsty, and consume water-rich foods like fruits and vegetables. While limiting caffeine and alcohol intake, which can contribute to dehydration, is also advisable. 6. Chronic health conditions. With the passing of time, many chronic health conditions become more prevalent and can directly or indirectly impact balance. For example, diabetes can cause peripheral neuropathy, where nerve damage leads to numbness and reduced sensation in the feet, making it harder to detect subtle changes in terrain and increasing the risk of falls. Parkinson's disease affects the nervous system and leads to muscle stiffness, tremors, and slow movements, all of which can compromise balance and coordination. Stroke survivors often experience weakness or paralysis on one side of the body, making it challenging to maintain balance and posture. Arthritis, particularly in the knees and hips, can cause pain and restricted movement, further limiting balance. Even conditions like heart disease or respiratory issues can reduce physical endurance and make it harder to maintain balance during everyday activities. Proper management of these chronic conditions through medications, physical therapy, and lifestyle modifications is crucial for maintaining balance. Regular exercise, good nutrition, and staying physically active can help mitigate the effects of chronic conditions on balance. 7. Medications. Many individuals in their later years take multiple medications to manage chronic health conditions, a practice known as polypharmacy. Unfortunately, some medications can have side effects that directly impact balance, such as dizziness, drowsiness, blurred vision, and muscle weakness. Common medications that may affect balance include antihypertensives for high blood pressure, sedatives, antidepressants, antipsychotics, and certain diabetes medications. As the body ages, it metabolizes medications more slowly, increasing the risk of side effects. The combination of multiple medications-drug interactions can compound these side effects, making it difficult to maintain stability. Additionally, some medications, like diuretics, can lead to dehydration, further contributing to balance problems. It is essential for older adults to have regular medication reviews with their healthcare provider to ensure that their prescriptions are appropriate and to minimize the risk of drug-related balance issues. In some cases, adjusting dosages or switching to medications with fewer side effects may help improve balance and reduce. 8. Vitamin B12 deficiency. Vitamin B12 is an essential nutrient that supports the health of the nervous system, plays a role in producing red blood cells, and aids in DNA synthesis. As we grow older, the body's ability to absorb B12 from food decreases, especially in individuals who take medications that reduce stomach acid eosinol conditions that impair nutrient absorption. Not getting enough vitamin B12 can really affect your balance, because B12 helps protect your nerves. Without adequate B12, nerves can become damaged, leading to symptoms such as numbness, tingling, and weakness in the hands and feet, which can disrupt coordination and make walking difficult. B12 deficiency can also affect cognitive function, leading to memory loss, confusion, and balance impairments. In severe cases, B12 deficiency can cause peripheral neuropathy, a condition characterized by nerve damage in the extremities that can further impair balance and coordination. Older adults should monitor their B12 levels and consider supplementation if necessary. Foods rich in B12, such as meat, fish, eggs, and dairy, should be included in the diet to support nerve health. 9. Vision changes. Our vision is a critical component of balance, providing the brain with information about our environment, the position of objects, and the horizon. Several eye conditions can impair our ability to see clearly and, consequently, affect our balance. Cataracts, glaucoma, macular degeneration, and presbyopia, the need for reading glasses, are all common age-related vision problems that can lead to reduced depth perception, poor contrast sensitivity, and difficulty seeing in low light. When vision deteriorates, the brain receives less accurate information about the surrounding environment, making it harder to avoid obstacles and judge distances. Reduced peripheral vision also contributes to balance problems, as individuals are less able to detect objects in their surroundings. This can be particularly dangerous when walking on uneven surfaces or navigating stairs. Wearing updated prescription glasses, using proper lighting at home, and having regular eye exams are essential for maintaining good vision and supporting balance. In some cases, separate glasses for reading, driving, or walking outdoors may be beneficial to improve overall visual acuity and reduce the risk of falls. 10. Decreased proprioception. Proprioception, often referred to as the body's sixth sense, is the unconscious ability to perceive where our limbs are in space. This sensory input is crucial for balance and coordination, allowing us to move without constantly looking at our feet or body parts. Over time, proprioception declines due to reduced sensitivity of the mechanoreceptors in our muscles, tendons, and joints. These receptors provide feedback to the brain about body positioning and movement. As proprioception decreases, it becomes more difficult for the brain to coordinate movements effectively, especially in complex tasks like walking on uneven terrain, stepping over obstacles, or turning corners. This decline in proprioceptive awareness can lead to increased stumbling, tripping, and a higher risk of falls. You'll really notice proprioception problems when walking in the dark or on uneven surfaces like carpets or slippery floors. To improve proprioception, exercises that challenge balance and coordination, such as standing on one leg, walking heel to toe, or using balance boards, can be beneficial. Additionally, engaging in activities that focus on body awareness, such as Tai Chi or Pilates, can help maintain proprioceptive function and prevent falls. 11. Inner ear problems. The inner ear, specifically the vestibular system, plays a vital role in maintaining balance by providing the brain with information about motion, head position, and spatial orientation. With age, the tiny hair cells within the vestibular system gradually deteriorate, reducing the system's ability to detect movement accurately. This deterioration can lead to a variety of balance-related issues such as dizziness, vertigo, and unsteadiness. Vertigo, a sensation of spinning or swaying, is one of the most common symptoms of vestibular dysfunction in older adults and can occur suddenly, making it difficult to maintain stability. Other vestibular disorders, such as benign paroxysmal positional vertigo, BPV, occur when small crystals in the inner ear become dislodged, disrupting balance signals sent to the brain. These conditions can make it challenging to walk in a straight line, stand up quickly, or navigate tight spaces. Inner ear issues can also be exacerbated by other health conditions, such as high blood pressure or cardiovascular disease, which affect blood flow to the ear. Vestibular therapy can help your brain adjust to balance issues, with exercises designed to improve how your body keeps steady. 12. Joint stiffness. Joint stiffness is an inevitable consequence of aging due to the gradual wear and tear on our cartilage and connective tissues. Over time, cartilage, the smooth tissue that cushions joints, begins to break down, causing friction and discomfort. Additionally, tendons and ligaments lose their elasticity, leading to reduced flexibility. This stiffness can be especially problematic in weight-bearing joints like the knees, hips, and ankles, which are crucial for maintaining balance. Age-related conditions such as osteoarthritis also play a significant role in joint stiffness. Osteoarthritis causes inflammation in the joints, leading to pain and restricted movement. As joint stiffness increases, our ability to make rapid adjustments to our body position decreases, making it harder to react in situations where balance is compromised, such as when tripping or walking on uneven surfaces. Regular movement is key to combating joint stiffness. Engaging in low-impact exercises such as swimming, yoga, or Tai Chi can help keep joints flexible and improve range of motion. Stretching exercises that focus on increasing flexibility in the hips, knees, and ankles can also help improve balance and prevent falls. 13. Muscle weakness. As we progress through life, our bodies naturally undergo sarcopenia, a process where muscle mass and strength decline. This gradual loss of muscle can begin as early as our 30s but tends to accelerate after age 50. By the time we reach our 70s and 80s, the loss of muscle mass can become quite pronounced, leaving us with significantly weaker muscles. The muscles in the legs, hips, and core are especially important for balance and mobility, and when these muscles weaken, we become more prone to falls and instability. Sarcopenia is not solely caused by aging but is often compounded by a lack of physical activity. When we stop engaging in regular exercise, we lose the strength needed to recover from stumbles and missteps. This becomes more serious when other factors like poor nutrition come into play, as the body requires adequate protein intake to maintain muscle mass. Incorporating strength training exercises such as resistance training, weightlifting, or even body weight exercises like squats and lunges can help maintain muscle mass and support the muscles necessary for balance. Regular physical activity also enhances neuromuscular coordination, which further contributes to improved balance. As we age, maintaining balance isn't just about preventing falls, it's about preserving our independence, confidence, and quality of life. By incorporating regular strength training to keep muscles strong, practicing activities like yoga or Tai Chi to improve flexibility and balance, and doing simple exercises to enhance proprioception, you can greatly reduce the risk of losing stability. Remember, while we can't stop the effects of aging on our inner ear or vision, we can take steps to minimize their impact. Make sure to schedule regular checkups, keep your glasses updated, and ensure your home is well lit to avoid unnecessary risks. When it comes to medications, always consult with your doctor about any side effects that could affect your balance. Hydration is another important factor, so keep that water bottle nearby. If you're dealing with the fear of falling, consider working with a physical therapist or taking a fall prevention class to build confidence and improve your balance. For those with decreased foot sensitivity, stimulate those nerves with simple exercises like walking barefoot or using a tennis ball under your feet. Posture and cognitive function also play key roles in maintaining balance. Simple posture checks throughout the day, along with staying mentally and socially active, can help you stay sharp and steady. Don't let balance issues hold you back. Take charge with small, safe steps. By making these adjustments, you're not just preventing falls, you're ensuring you can keep doing the things you love. If you found this video helpful, don't forget to give it a thumbs up and share it with others who might benefit. We'd love to hear from you in the comments. How are you managing your balance? And of course, hit that subscribe button and turn on notifications to stay updated with our latest tips for healthy living. Your support means the world to us. Thanks for watching, and we'll see you in the next video.